Hi, I'm Diane Joseph-McCarthy, and today I'm going to talk about some of the use of computational approaches that we're doing to develop mitigation and response strategies for future pandemics. So the COVID-19 pandemic has shown us that to be better prepared for the next pandemic, we need to have all the relevant information available in an easily accessible global resource. And to that end, we're generating a map of current readiness with respect to therapeutic targets, therapeutics, and vaccines. So we're using large language models to carry out enhanced literature review that reduces the timelines dramatically. And in a first example of that, we have created a novel pipeline using prompt engineering techniques to identify drug targets from the literature. So this has involved fine-tuning or retraining a generic pre-trained model. So specifically, we found that using ChatGPT was ineffective, but that when we combine that with chain of thought or COT prompting, as well as ensembling, the performance dramatically improved. So, and that's where chain of thought prompting is where you ask ChatGPT to provide an explanation for its answer. And ensembling is where you ask ChatGPT the same question multiple times, and then you take a majority vote. And so here the question was, does the paper describe a drug target or not? And for SARS-CoV-2, we got an impressive 93% accuracy. For Nipah virus, it was 87% accuracy, but there the data is much more scarce. So the continued, and that's compared to human experts. So the continual development of these biomedical tools will feed back into keeping our map of current readiness automatically up to date. Now, currently, the only effective treatment for COVID-19 is Paxlovid, and that was developed based on prior work looking at other coronaviruses. So essentially, they already had a drug target and a starting point. So looking ahead towards pandemic preparedness, we're developing approaches for identifying druggable sites on therapeutic targets. So we're using FTMove to assess the druggable sites for a target in a rapid and automated way. So FTMove pulls out all of the structures from the protein data bank that have 90% or more identity to the structure that you've input. It then calculates the binding site hotspots on all those protein structures, and then it clusters the results. We're also developing improved ranking schemes to be able to select the most druggable sites. And for proteins without structures, we're using the AI-based AlphaFold approach to predict the structure. And if you can assess with a reasonable confidence level that a biological target has a druggable site, then that information can be used for future drug repurposing efforts. So for many of the viral targets that we're interested in, the structural data is limited. So we've also examined the use of AlphaFold models for doing the hotspot calculations. So we looked across a benchmark set of 62 protein ligand complex structures, and we showed that in 66% of the cases, if you use the AlphaFold model, you were able to identify a druggable site that overlapped with the known position of the ligand. And if you use the protein ligand complex structure, that increased to 71%, but if you use the unbound X-ray structure, it was 62%. So the AlphaFold model was right in between the two types of experimental structures that you might have available. And finally, we're exploring the use of AlphaFold for generating ensembles of structural models for a given protein and comparing that to the distribution of structures for that protein that you would find in the protein data bank. And here you can see a figure of beta-lactoglobulin, and this particular protein has a loop that can be either in an open or a closed conformation. And what the plots are showing you is that both for the models as well as for the structures, they both show conformations with the loop open as well as with the loop closed. And so the distributions are similar. So these data taken together indicate that AlphaFold models are sufficient for hotspot mapping, which should significantly expand the number of targets we can successfully apply these structured guided approaches to for drug discovery. And as I mentioned at the beginning, all of this is being done with a view towards creating a publicly available resource or database where will include information, which will include information on drug targets, including pre-computed hotspot binding sites and potential drug repurposing candidates. So they'll be pre-stored so that that should allow for rapid response. Thank you.